Hi, this is Dr. SaraSaddiqui, and I'm here for another installment of my Facebook series on behalf of the Elwood Public Library. And this month, we're going to be talking about childhood allergies. Okay, so let's get started. This is Dr. SaraSaddiqui, and I just wanted to thank the Elwood Public Library for allowing me to talk about a topic every month. And if anyone has any ideas or anything that they want me to talk about, please feel free to contact the Elwood Public Library, the reference desk, and they will be happy to help you. And we could perhaps talk about that next month. I have no disclosures to identify, and again, please discuss any specific concerns with your child's healthcare provider. And this talk is for informational purposes only and does not replace any medical advice that you may have received. Thank you again to the Elwood Public Library, and thank you to Eric for helping me to edit and post. And if you have any questions or comments, please contact the reference desk at the Elwood Public Library. So just to make a brief outline of what we're going to be talking about. So we're going to be discussing specifically environmental allergies. So we're not going to be really talking about food allergies. It's a little bit different. So environmental allergies in children are very common. About 7 to 8 million children in the US suffer from this seasonally. And what are some symptoms? What are some causes? Some diagnosis and types of testing, treatments. And then we're going to just have a brief discussion about eczema and asthma that can also accompany environmental allergies in children, and they kind of are on the same genetic pathway. So we always kind of talk about these things together in the office. So what are seasonal allergies? Well, these are symptoms that can occur at different times of the year, and they're usually repetitive type symptoms. They're rare in children under 2, as it does require repeated exposures to develop allergies, so you kind of have to become sensitized to it. Although we are seeing some children younger and younger present with symptoms that look like allergies, it may not be specifically seasonal allergies. It usually results from a little bit of a hyperactivity in your immune system, and it's responding to things that are mostly normal, but your body is reacting to it in a certain way with a heightened immune response. And once that immune response is triggered, it releases a cascade effect, including a histamine release, which causes a lot of the symptoms that you may be seeing in your child or yourself. It's typically at different times of the year, and certain allergens can be year-round depending on the type, such as dust and mold. And the way it enters our body is usually through the mouth, nose, and eyes. And in the spring, the most common ones would be flowers, tree pollen, grass, or ragweed. And sometimes in the fall, weed pollen and mold spores are pretty common. And the most common environmental allergies, again, are pollen, grass, ragweed, mold, or fungi. And these are ones that you can't really see. You can't detect them with the naked eye. These are microscopic organisms that can kind of grow in, for example, leaves, like piles of leaves that have been kind of out throughout the season. In the fall, they can have certain mold particles in them. Dust mites, and then there's certain trees that can cause allergies to us as well. The most common symptoms of allergies, so allergies can mimic colds. If you want a discussion about colds versus allergies versus flu and things like that, I did have another talk previously, so you can kind of go in the archives and look at that. But allergies are usually repeated symptoms and can be reoccurring. Oh, I have a spell check in there, sorry. Reoccurring for over a 2-week period. And these can include sneezing, coughing, sore throat, itchy or watery eyes, runny nose or a blocked or stuffy nose, lots of nose rubbing and dark circles under the eye. And actually there is something called an allergic salute, which I talk about in the office. It's a little line that's kind of right on top of the nose. And it's basically from people with allergies constantly kind of pushing their nose up to get like a little bit of an inhalation or congestion, sniffing a little bit, and that can cause a little line right at the tip of your nose. And sometimes when we examine you, we kind of look for those things to see if you may be suffering from allergies or your child may be suffering from allergies. So why, should we treat allergies? Well, some of them do have some consequences. Sometimes if you really are a allergy sufferer and you have those sneezing, coughing, congestion type symptoms, it can disrupt your sleep, and that can result in poor concentration in school from lack of sleep, or you can even have symptoms during the school day. So that also disrupts your child's ability to concentrate in school. Sometimes there could be behavioral issues from lack of sleep. So we can get a little bit easily irritable from not being able to sleep, and that also can cause difficulties in concentration during the school day. You can have increase in sinus and or ear infections. So we see a lot of this once you start having the allergy symptoms for a few weeks, or that can result in a sinus infection or an ear infection just from that chronic congestion, just kind of dripping down the back of your throat. And allergies can result in asthma exacerbations and can trigger certain irritation in your lungs to make you start wheezing. And then that can cause a cascade effect as well. And then just from having repeated inflammation of the nose and back of the throat and chest, that can also inflame that area and constantly give you like a sore throat, things like that. So types of testing for allergies, there's multiple different types, and sometimes the accuracy of them can be up and down. So skin testing, it's usually the prick test, although it doesn't have to pierce the skin all the way. Sometimes it can, make the child a little bit uncomfortable, and usually this is performed by an allergist or an otolaryngologist, also known as an ear, nose, and throat doctor. These testing can change over time, so sometimes you have to repeat the tests every few years. If you have severe eczema or you're on antihistamines or any medications, this can impact the results and the accuracy of the testing. So you have to be off all medications for 3 to 4 days or up to a week prior to getting tested. So sometimes I don't recommend my patients to get testing done during the peak allergy season, because it would mean that they would need to be off of their medications to do the testing, and they can be quite uncomfortable during that time. There are blood tests that can also give us an idea of whether you're allergic to certain things or not. And again, the accuracy of this can be influenced by if you have a high overall allergy response. So it is measuring something called IgE, which is part of your immune system. And it can detect immune response or IgE-mediated response to foods and environmental allergies. But again, if you have an overall heightened IgE level, that will affect the results, and it will show that you have lots of allergies, whereas maybe you may not. So there could be some false positive results on that. So we usually try to do both when we're doing the allergy testing, because it is important to kind of be accurate. Again, there are also oral or exposure challenges, so these have to be done very carefully and under a monitored setting. Obviously, if you are going to be exposed to something that you're allergic to, you want to be able to treat it in case things get worse. Usually this corresponds to food allergies, which we're not really going to be talking about, but there are oral challenges that we can do in the office or with your allergist to see if you're still allergic to an item. Sometimes this is done with antibiotics as well. Again, we're not talking about those. We're really just concentrating on environmental allergies. And so treatment. So this is a very a really common reason why people come into the office is to help talk about the treatment that they would like, or if some of the over-the-counter treatments aren't working, sometimes we have to prescribe certain things. But again, talk to your doctor regarding specific treatment options. But just to give you an overview, again, you can avoid the allergens. So once you kind of figure out what your child is allergic to or what you're allergic to, avoid those things. Sometimes it's easier said than done, though. You can treat with antihistamines. So there's long-acting and short-acting ones. The antihistamines do come in first generation and second generation. So the older generation, which is the diphenhydramine, or the brand name is Benadryl, is something that can cause drowsiness, and it is very short-acting, usually 4 to 6 hours. We'll use that for if you've been exposed to something, and for an immediate response, you can take Benadryl or diphenhydramine, and please talk to your doctor regarding specific dosages. But this can make your child very drowsy. So we really don't recommend this for the school day. Even for adults, if they take Benadryl, they should not be driving or operating heavy machinery. The long-acting ones and the non-drowsy medications, the brand names such as Zyrtec, Allegra, Claritin, these are all non-drowsy long-acting medications. Usually they last 12 to 24 hours. And you want to discuss with your doctor specific indications. And these usually do tend to help if you've been exposed, but they don't work right away. They usually need some time to get into the system. So usually I encourage patients to try it for a week or two before deciding whether it's working or not. There are certain eye drops that are over the counter that you can use for allergy or irritated eyes. They're usually antihistamine eye drops. Again, you want to speak to your doctor. We don't really recommend Visine or like just anti-redness drops because they're not really good for you. They're not treating the underlying issue. They're just kind of constricting the blood vessels in your eye for a short-term response. It's not treating the underlying issue as to why your eyes are irritated or watery or tearing. And then, of course, decongestants, which we don't usually like to use as often in children. I like to encourage using the antihistamines, and then sometimes if you need it, we can discuss decongestant options. Nose sprays. So nose sprays are a very, very good way to treat allergies as well. Flonase, which is the over-the-counter, it's over-the-counter now. It's a steroid, or fluticasone nose spray, which is has a slight bit of steroid in it. And what that does is decrease the inflammation around the nose and in the back of the throat. And there are also antihistamine nose sprays, which work the same way as, let's say, an oral antihistamine, but it goes directly into the nasal passage area and can decrease some of the histamine response there. Of course, if you suffer from asthma as a result of your allergy, sometimes you may need an inhaler, whether it's a short-acting, such as albuterol, or a long-acting, such as a steroid inhaler. These are both ways to treat the asthma or wheezing episodes. And then the last thing that you can discuss with your doctor is something called immunotherapy, which is oral. There's also injected versions where the idea is to slowly desensitize your body by giving you small amounts of the allergen that you have allergies to, so that your body slowly responds and can become desensitized over a period of time. This involves weekly either injections or oral, like a low dose oral therapy is also something that's available, but again, you need to speak to your doctor or allergist to discuss this. Some ideas of avoidance. You can either avoid the triggers, or if you've been exposed, you can try to get it out of your system. So let's say pollen, you really want to wash hands or face when exposed to pollen or other allergens, so that you're not breathing it in constantly. And I do encourage nighttime baths during the allergy season, because you really want to wash it out of your eyes and your face area. It can stick to your hair. So sometimes if you don't wash up and you go to sleep, you're going to constantly be inhaling those allergens. And in the morning is when you usually wake up with the really increased irritation and congestion. And then keep those windows closed during peak time of allergy season, because the pollens can come into the house. Wash your bedding and towels at least once a week in hot water, and dry in the dryer, because that will really get rid of all the pollens. If you have pet allergies, which we're really not talking about, but just to throw that in there, then avoid the pets on the sleeping areas. So you want to have, if your child is allergic to a cat or dog and you have one, obviously they're a part of your family, so they're going to be there, but you don't want them to be sleeping in the area that you don't want them to have the allergens accrue on the bedding areas, so that your child just breathes it in constantly, and then they'll have the allergic response in the morning. And then dust mite allergies, you want to cover the bedding and pillows to avoid prolonged exposures at night during sleep again. And just to talk a little bit about eczema and asthma, so they can be related to the allergies. It's kind of on the same genetic pathway. And so family history does play a role. If you have a family history of asthma and allergies and eczema, most likely these and or eczema, or one out of all three, they all travel in the same genetic pathway. So eczema are these dry skin patches that can be exacerbated by certain allergies. And again, the treatment is avoidance of triggers, and then moisturization. So your skin is one of the largest organs of your body. If you're a patient of mine, you know that I've told you that many times. Your skin is the largest organ in your body, and it's really important to keep your skin as intact as possible. So if you suffer from eczema, it's something that you should be treating with moisturization as much as you can, because you really want to keep those areas nice and closed. If there is an open area of inflammation, you may talk to your doctor about maybe starting a steroid-based cream or lotion. And then there's also anti-itch creams or oral medications such as the Benadryl or diphenhydramine, which can help. And again, these are all immune-mediated responses. So again, it's your immune system that's hyperfunctional, and that's causing the issue. And asthma, this can be a whole topic in and of itself, but I just wanted to touch upon it because we do see asthma exacerbations when children suffer from allergies, and this can be seasonal as well. So in the springtime, we start seeing all the kids that suffer from asthma coming in because their allergies are triggering it. So this is children with sensitive airways, and they can have recurrent wheezing or asthma, and many triggers can contribute to exacerbations of asthma, such as colds or coughs, viruses, weather changes, allergens like pollens, dust, or pets, air pollutants, and certain fumes from smoking, vaping, or exhaust. These are all things that can trigger our airways to react if you have a predisposition to asthma. And again, the treatments are avoidance of triggers, some certain inhalers like the albuterol, which is like a short acting, again, dilation of the lung tubes. And there are certain steroid inhalers which prevent long-term, which can, if taken long-term, can prevent asthma exacerbations. And these are, I call inhaled steroids kind of like moisturization for the lungs. So just like eczema, you need moisturization on your skin. If you have chronic asthma and you have multiple exposures and multiple episodes of wheezing, sometimes you need an inhaled steroid to help calm your lungs down. And again, just as an overview, some children may outgrow allergies, asthma, and eczema. So a lot of children that I see that may be under the age of 4 or 5, sometimes they can outgrow it as they develop into their teen years. Sometimes we see a period of time where they don't have it, and then it resurfaces during puberty or afterwards. And family history and genetics do play a role in the development of allergies. You know, if you have someone in the family with allergies, sometimes the kids can have asthma or eczema or allergies. And you do want to speak to your child's healthcare provider to discuss diagnosis and specific treatment options. So these are some references that I use. You know, I love healthychildren.org. And then there's also a CHOP.edu, Children's Hospital of Philadelphia, which does have a lot of important information that you could find. And thank you very much. I really enjoy doing these talks and discussions. So please, if you have any questions or comments or just want to give some feedback, please call the Elwood Public Library, and we will see you again soon. Thank you.